What's up, y'all? This is Not a Real Doc DPT, and no, I'm not a real doc, but I am a licensed and practicing doctor of physical therapy. And today we're going to be talking about what you need to now expect and do now that you have had your back surgery. So, if you haven't already, I had a previous video about surgeries or back surgeries and what you should expect before your surgery. So, to kind of pick up from where we left off there, um, so you've had the surgery, now you're coming back home. Um, so, the first thing that you're going to be thinking about is just overall safety and protection. Okay, so you're going to want to know, do you have any um, trunk precautions? Should if you had a back fusion, typically they're going to tell you no bending, lifting, or twisting. It's going to be no lifting greater than 10 to 15 pounds, depending on the surgeon. Sometimes there's no lifting at all, so you will want to kind of clarify that. But the surgeons around us that we typically deal with have generally gone into the about 15-pound range. And so you may have discharged home with a back brace. If you have that, you're going to want to wear that at all times unless you are sitting down, and usually that's only for a brief period. Usually you're going to want to keep that on for the first, for sure, at least the first week. Um, maybe maybe into the 2 to 3 weeks. That will depend on your surgeon. And I say that usually so there's a lot of variety here, okay? It does depend on your surgeon. Your surgeon has a big call, and not necessarily everybody follows the exact same protocol on these. But if you had a back fusion, you are going to be wearing a more than likely a back brace for a few weeks, and you may wean yourself off of that over time. But in general, that's is what you're going to be expecting. Um, if you have um, those precautions as well. Those are generally going to be in place for around that 4 to 6 week kind of range. Your surgeon will be the one to determine that, and is that, you know, for what length of time that's going to truly be in place. Um, the as we say, going back to in big picture, what you're first thinking of when you're coming home, that's going to be the safety. It's going to be protection. So you're going to make sure that you are not having any sort of falls. So if you're using an assistive device, then if you discharged home with that, you're going to be on a walker. Usually with a walker, if it's a back fusion, you may be on a walker like 1 to 2 weeks, maybe sometimes even a little bit longer than that, kind of depending on the um, the type of surgery that you had. The more invasive that the surgeon was, the more that they had to install. And sorry, my our dog is barking. Um, the but depending on the invasiveness of the surgery, then that may require a greater assistive device. So if you had a back fusion, usually those patients are going to be on some sort of an assistive device, whether it's a cane or a walker, for at least the first week to two. If it was a bigger surgery, then it may be longer than be greater than that. Um, the you also thinking about from a safety and protection standpoint, so you want to make sure that you're not having any falls. You want to make sure that you're falling into the overall trunk precautions that you were given. You'll also be taught how to perform a log roll to get into and out of the bed. So that's going to be usually that will be taught to you by your hospital physical therapist before, like the acute care physical therapist, before you leave before you're discharged from the hospital. If they didn't do it, then your home health physical therapist will be doing that with you. And then you're going to want to think of, as far as safety and protection, the area where your surgery was. Usually that's going to be covered by some sort of dressing. Oftentimes it's a non removable dressing that generally gets taken off when you return to your surgeon in that first week to 2 week follow up visit. And you're not going to want to get that area wet. So there's going to be no soaking, no getting into a bathtub, no getting into a pool, no getting into. I've had a patient who thought it might be a good idea to try to get into a hot tub afterwards. No, that's not a good idea. Don't get into a hot tub. Um, the your incision there is still open. It is still potential. You still have the potential to get microscopic, bacteria and particles into there, and so you can lead to an infection. So, again, we're talking about the number one most important thing after your surgery is going to be safety and protection. So it's not only going to be you and making sure that you don't have a fall and etc., but also, excuse me, but also protecting the area of the incision as well. You don't want to, come down with some infection because you let some particulates. Maybe you're washing your hair and you let that run down your back and let your back get that dressing get saturated. So it now usually if it's covered with a non-removable dressing, that non-removable dressing will be you'll be told that it will be water uh, um, resistant, but it's not waterproof. Okay, so yes, if you had some incidental drops, like splashes across the dressing and things like that, yeah, that's not going to do anything to it. That'll be fine, but you don't want to soak the area, or that you sometimes what a lot of the surgeons are telling patients now is to put press and seal over top of even the non or even the water resistant dressing to make even more certain that that area stays protected. But infections are a big deal. They don't happen a lot. It's not something that is something that you should necessarily worry about. However, you should be aware that they do happen. Okay, so if you had, say, a ton of drainage onto your dressing, you're going to want to call your surgeon about that. And if you're not able to get a hold of your surgeon, you're probably going to want to take yourself to the ER. Okay, that is not anything that you're going to want to mess around with. And when we say a lot of drainage on the dressing, usually what the surgeon is meaning when he says that is the entire dressing looks like it's sopping wet and is about to come off because there's so much drainage. Like, it's very normal to have some drainage of blood. It may be half dollar size or a couple of half dollar sizes, and stuff. But we're talking if it is that, I mean, that's normal. That's not that big of a deal. But if it is sopping wet, where it looks like that dressing is just soaked with drainage, then you're going to want to see either the surgeon or go to the emergency room pretty quick to have that looked at. Okay. Um, you will over time, like we talked about, uh, you're going to want to use an assistive device. The more invasive the surgeon was, the more likely that you're going to be using one for a longer period of time. Um, and you might have a higher um, need for more stability. So if you had a back surgery, if you were already maybe a pretty deconditioned person, you weren't very in shape, you're probably going to expect to use that walker for 2 to 3 weeks. If you were someone who was, fairly in shape and took care of yourself and were having this surgery, you might get away with just using a cane for, say a week or two. Um, there, everybody is going to be a little bit different in that regard because we all come to the table with different previous fitness levels, which will help us or hurt us depending on which one that is, in the recovery process. Also, every surgery is going to be different, as I've mentioned. If the more invasive the surgery is, then the more likely you're going to need more of an assistive device, and the longer it's likely going to take to recover. Also, everyone's surgeon is going to be a little different. We have some surgeons who are pretty insistent that you're going to be on a walker for 2 weeks and don't question that. So there are several variables that go into whether or not you're going to be using, or not whether or not you're using an assistive device, but for how long you're going to be using one. Um, so your physical therapy, most everyone after a back surgery is going to require some sort of physical therapy. Um, I say most, it's not 100%. If you had, say, a minimally invasive laminectomy where they were just removing some arthritis and opening up set joints, let's say, in your spine, then very well may be that you don't have any physical therapy at all. If you were already pretty in shape, you have the surgeon has a good understanding that you will be able to kind of pick up exercises on your own and progress yourself afterwards. You might not see a physical therapist, but most patients are not going to present with that. Most people are not in shape. Okay, that's the outlier. The most people are going to require physical therapy. Usually, it's going to start with home health physical therapy. They will be looking first at big picture stuff with you, making sure that you're safe in your home, that you're are going to keep things protected. Again, that's the number one thing for you, that you're not going to have a fall and do some sort of damage to that surgical area. And then they'll be working with you on um, really getting up and walking. Get usually the most important exercise for a patient coming out of a surgery, especially with like a back fusion, is going to be get up. You're going to need to get up about every 30 minutes to an hour and walk. Um, but we want you to walk at a low intensity. We're not saying, get up and walk, all the way around your neighborhood or something like that. It's just get up, walk a little bit in the house, on a, flat level area, and stay at a low intensity. And then about 30 minutes to an hour later, do that again. 30 minutes to an hour later, do that again, and do that throughout the bulk of the day. I usually would tell patients, if you're in that situation, that you're going to want to do that probably at least about 8 to 10 times per day. So frequently getting up and moving and walking for longer and longer periods of time as your strength and improvement goes on. So that way you're still staying at a low intensity, but it's just you're getting stronger as the more you do. That's why you're progressing it for longer periods of time. But that really is the number one exercise, the number one thing that you're going to want to really be focused on after your surgery. You're going to need to move. Probably the single worst thing that you could do for yourself after a surgery would be just to sit in a chair and not do anything at all. You're going to get very stiff. Things are going to hurt. It's not going to feel good, and that's not a good way to go to successfully recover from physical therapy. Um, you may then progress to outpatient physical therapy, where they're going to continue working with you, doing exercises to stabilize your trunk, and doing things to stabilize just the muscles that are supporting all of the areas where that surgery was done, and then progress you to be more functionally mobile after that. So that's generally the track that you're going to be continuing to follow over outpatient physical therapy. Um, the whole thing will probably go for about 4 to 6 weeks. If you had a significantly invasive surgery, you may go a little longer than that, and maybe go on the 8 to 12 weeks even. I think I've had a couple of patients that we've worked with them even out to 12 weeks. But I've also, as I say, had a few patients who kind of came in, did the drill for the first visit or two, and that is really all they needed, and they didn't need a ton of physical therapy after that. So I'm not trying to sound vague and non-specific here, but it really does depend on the what you had done. It's the more invasive it was, the more it's going to take, the more you're going to need assistive devices, the more recovery time that you're going to need. The less invasive that they're needing to be, the more um, delicate that the surgeon is able to be. Um, then the less invasive on that side, then the less you're going to need of all of those things. But your number one things to think of are going to be safety and protection for the surgical area. That doesn't matter what was done. That's going to be really important. No falls. So if you need an assistive device to prevent that, then do so. And then movement. You got to move. That is also going to be critical for everyone. The worst thing you can do, no matter if it was a really invasive surgery or a not so invasive surgery, worst thing that you can do is just sit and not do anything at all. So, well, I hope that this has been beneficial for you. I hope that your recovery from your back surgery goes well. We'll be saying prayers for you. And if this material was helpful to you, then give us a thumbs up. This is a new channel and we're trying to grow and get this kind of material out to more and more people. And, help doing the thumbs up, subscribing, all of those things are things that can really help us to be able to do that. So, well, again, we'll say prayers for you. And if it could be of any help, please put a comment below, ask questions. I will answer them as best I can. And good luck to you. All right, we'll catch you next time. Bye.